Welcome to your 2024-2025 Employee Benefits Open Enrollment for ExPert ENP. This is your open enrollment period to make elections that will be effective July 1st, 2024 through June 30th of 2025. We'll take a look at the different benefit plans that are offered during open enrollment for the coming plan year. We do have 2 medical benefits offered that will continue through United Healthcare, the Surest plans. Beginning July 1st, our dental and vision plans will be administered by United Healthcare, with the vision network being Spectera. The disability, life, and other voluntary benefits will continue through Guardian. Your open enrollment elections are to be made in the all-pay system, and they need to be captured by June 7th for this plan year. Your base plan is the Surest Choice E7000 plan, and the buy-up option is the Surest Choice B4000 plan. Both of these plans have the same national United Healthcare network. For the plans, you can see that there is no deductible to be satisfied, and the coinsurance is 100% on both plans. The out-of-pocket maximums on the base plan are $7,000 and $14,000. For the buy-up plans, they're $4,000 and $8,000. When you look at the office visit services, those you will see have a lower copay on the buy-up plan, and you have a higher out-of-pocket whenever you have the base plan. Virtual care is covered with no copay. Your urgent care, $80 on the base plan and $30 on the buy-up. And the rest of your benefits, when you look at those, you can also see how the copays when you have the base plan are higher for the members, and then on the buy-up plan you have lower copays for the services. Whenever you see these ranges in your copays, those are determined based on the provider that you go to for your care. So whenever we look briefly at how that app works, you'll see that they list the different providers, and you can see the copay that applies to each. For the prescription drug services, they are considered tiers, with tier 1 generally has a lot of our generics in there. Tier 2 has, some of our brand name meds. Tier 3 is generally all brands, and then specialty, those are oftentimes injection medications. So those do have a higher copay than the other tiers of prescriptions. So for the Surest plan, there is both an app, and each of these is a unique QR code tied to the 2 plans that are offered. And there's also a web address. So if you don't use the app on your smartphone, you can also use a computer to go to the website, and these codes direct you straight into each of the plans. Once you're there, you're able to do searches to locate providers that participate in the network, and then it will pull up the different services. So in this example, they actually knew the doctor that they were looking for. They put the doctor's name in the bar. They popped up Dr. Beecher and some of the common cost for seeing Dr. Beecher. You can also look for services based on a provider type, and when that happens, you would see the different providers listed with the applicable copay for those providers. So we encourage you to use those barcodes or those QR codes that we have on the prior page, or get online and take a look at how the app works. It's a lot like using a travel app where you get these different hotels, and it has pins with the different dollar values on how much it is per night. Well, in this case, it is what is the copay based on each of the different providers that you can go to for those services. Surest has a great member services department. They are available Monday through Friday, 6 a.m. to 9 p.m. They can help you with provider services, searches. They can also help you with any claim status. If you have any questions about the prescription benefits, they are there to assist you with any questions on your medical plans. The medical insurance, 2024 rates are noted below, and you will see those whenever you go through your enrollment in the all-pay system. As I mentioned, the dental and the vision, we're having a carrier change. We're going to be with United Healthcare beginning July 1st. So we encourage you to visit the website to take a look at the providers that are participating in the network. While both of these plans have non-network benefits, you always get the best benefit when you use a network provider. So while we're being enrolled, you go to the general www.myuhc.com site, and then the instructions to find a dental provider. You navigate to the healthcare link provided above. Then you select find a dentist. You enter your location. You want to make sure that you select the National Options PPO 30, and then you'll be able to choose the category of provider that you want to check the dental network for. For the vision, again, you're back at that United Healthcare link homepage. You want to select find a vision provider, employer and individual plans, and then you update the location to match your desired parameters, and you choose the people circle, and a list of network providers will generate. So feel free to, look for different types of providers, whether you have a need for an orthodontist or just a general dentist, as well as the providers in the Vision Network. One of the big things whenever we have a carrier change, we want to make sure that you remember to notify your providers when you're getting services beginning July 1st and after. Let them know that you have a new insurance carrier, so they will submit that claim to the correct place. Humana will continue to process any of your claims for dates of service all the way through June 30th. And you have plenty of time for them to, get those claims in and get those claims processed. But we do encourage you just to monitor that you see that a claim for a dental service or a vision service has gone through Humana if it's something that's before July 1st. So for ID cards, with ID cards, United does not issue ID cards to your homes. They make your ID card available that you can view the ID card in the app. So once enrollment is processed, you'll be able to register as a first-time user, and you can use your social security number for the ID when you go through that registration process. And for the dental, you're going to go to the myuhc.com site. For the vision, you're going to go to the www.myuhcvision.com. And once you're in those sites, you can view your actual ID card. Those will be available July 1st once we have everything processed with United Healthcare. So when we take a look at the dental benefits, we're showing the in-network plan. You do have an unlimited annual calendar year max. So we still have that very nice, rich benefit on our dental plan. We have a $50 deductible with a limit of $150 per family. For our preventive services, those are covered at 100%. Our basic services are covered at 80%. Major services are at 50. Our orthodontia services. Our orthodontia services will be provided for only children to age 19, and that will be a 50% benefit. And there is a maximum on our orthodontia benefit, and that is $2,000. So while we always focus in on the network for your dental, you do have access to go to any dentist. Those claims would be subject to the 90th percentile of usual and customary. So if for some reason your dentist charges $120 for a service that is considered usual and customary $100, you would have to pay that difference in the cost, that extra $20 in addition to however your benefit was applied based on the benefits of the plan. Dental rates: employee only $19.32, employee and spouse $38.64, employee and children $47.32, and family coverage is $70.37 per pay period. For our vision coverage, it is United Healthcare. We are using the Spectera network. Again, we focus on the in-network benefits because that's where you can get the most benefit dollars out of your plans. The exam can be every 12 months and is a $10 copay. Materials and lenses are every 12 months also for a $15 copay. Frames are every 24 months. There's a $150 allowance for frames. Any balance after that, you can get 30% off. You do have a contact lens benefit, which is available every 12 months, and that's a $150 allowance. Whenever you get your contacts, we do encourage you to use up this full $150 because you get one claim per year, and you cannot get both contacts and eyeglasses in the same year. You have to choose to either get one or the other annually through your vision benefit. For the vision rates, $3.73 for employee only, $7.07 for employee and spouse, $8.29 for employee and children, and $11.67 for full family coverage. As we mentioned earlier in the presentation, our life and disability benefits are all remaining the same. They're going to continue with Guardian. You do have a great basic life and accidental death and dismemberment benefit, and this is coverage that is provided to you at no cost by ExPert ENP. And your benefit amount is $50,000, and your AD&D benefit is equal to the life amount of $50,000. So if for some reason you died as the result of an accident, like a car accident, your beneficiary would receive the $50,000 for life insurance and also $50,000 because it was an accident that caused your death. So it's like a double protection. There are age reductions on the plan, 35% at age 70 and then 60% at age 75. You're also available to purchase individual life insurance. It's voluntary, so if you feel that you need more than the $50,000, you can purchase amounts beginning at beginning at $10,000. The benefit maximum is 5 times your annual salary up to $500,000. And the same, they got the age reductions at age 70 and 75. When you elect voluntary coverage on yourself, you can also purchase voluntary coverage on your spouse. $5,000 increments up to a maximum of $250,000. And then your child benefit is available at $10,000. And you can see on the right-hand side, we have the rate tables, and this is per $1,000 of coverage and the ages where the different premiums amounts are, and then the child benefit for the 10,000 is a flat $4.05. So during this open enrollment, you do have to complete an evidence of insurability form, and it will have to be submitted to Guardian for approval. So if you apply for coverage that you did not have previously for voluntary life, you will need to obtain that evidence of insurability. It is an all-pay system. Complete that and submit that in for approval. For our disability insurance, it is also with Guardian. Our short-term disability coverage is automatically provided to you at no cost. ExPert pays for this coverage, and this is designed to help you if you're unable to work due to an accident or an illness that lasts in excess of 14 days. If you have an injury or illness and you're out more than 14 days, that's when this benefit would begin. It covers 60% of your base weekly salary up to $1,500 per week, and that benefit will run for 11 weeks. And there's no pre-existing uh, condition waiting period for this plan, because when you came on as a new hire, you were automatically enrolled in this coverage after you had met your waiting period. For the long-term disability coverage, this coverage is a voluntary benefit, so employees pay for all of this cost. It is deducted from your paychecks, and it's calculated as a percentage of your annual base salary. The benefit is 60% of your base monthly salary up to $8,000 per month. The elimination period is 90 days. So this is designed to pick up when your short-term disability has been exhausted. So if you had a longer-term illness, you would use your short-term disability first for the first 90 days. Then, if you have the long-term disability coverage, you would have additional benefits that would begin under your long-term after that first 90 days. Own occupation is available for 24 months, and then full benefit is available for any occupational to your normal Social Security retirement age. There is a 3-month, 12-month pre-existing condition period. Anything that you have been diagnosed with or been treated for 3 months before the effective date of your coverage is not covered for the first 12 months. So if you have a condition whenever this coverage becomes effective, that condition wouldn't be covered for the first 12. But if something happened and you fell and had, an extensive, you know, leg injury that required you to be out more than 90 days, that would not be considered a pre-existing condition, and that type of incident would be covered. If you have not elected the long-term disability coverage before and you do elect it during open enrollment, it also requires the evidence of insurability form and approval by Guardian. For your open enrollment, this is the period that you have to make your elections for the coming year. So if we don't get this done now, then you have to wait until next year for 2025, unless you have a qualifying event, which is a marriage, a birth, a change in employment. If you're covered under your spouse's employer and she changes jobs and you lose your benefits because you were covered by her, that's an event that you could come into the plan. It's very important that if you have a qualifying event, that you notify your HR department very quickly, because you only have 30 days to make those elections. Make sure you make your elections in all pay by June 7th. And just as a reminder, the deductible and out-of-pocket accumulators for the health plan, they do run on a calendar year. So, and the dental also runs on a calendar year. So that begins January of every year. So, while we don't have any deductible, we do have out-of-pocket accumulators on the health plan. So if you've already met that out-of-pocket accumulator, that will continue until January. And in January, your out-of-pocket accumulator will reset. For your dental, they will take credit for any deductible that's been met this year. You will just need to provide your explanation of benefits to United once you get your information from the online portal with your member number and the group number. And this is just a reminder about the opportunity to make your changes until your next annual enrollment, which would be for the July 2025 year. If you have any questions about your benefits, you can reach out to our office and speak with Crystal Clifford. We've provided her phone number and her email address. Of course, you also have your great HR team if you want to reach out to them, and they will get with our office and we can get them the information needed to address your question. Thank you for joining. Have a great day.